And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome to Keeping It 100, where we have these open and honest conversations to make sure you have the information you need to make good health decisions. I am your host, Dr. Kristen Motley. Glad to be back. As always, we have an amazing show today. And if you think of questions, if you want to leave comments, we want to hear from you. If you are just here, just say hi, give us a shout out. Please put it in the chat. My friend and colleague, Dr. Tyne Thomas, is behind the scenes. She is going to make sure your questions are answered, and she's going to show you some love in the chat. So let's get started. We have a big show today. So let's bring in my co-host, Mr. Georgie Mink Jr. What up, G?
Hey, what's going on, Doc?
How you living?
I'm all right.
What's up?
None, I'm just coming down off off our weekend run, and
wow, we did 5 events. Shut up.
Yo, Doc, wow.
We was in them streets. 5 events in 3 days, like 2.5 days. It was a lot. It was hot. It was hot this weekend.
It was, Doc. I mean, it was a blessing too, but it was like we was working. Shout out to our teammates, Francis and Thomas.
Hey y'all.
All the physicians that showed up with the vaccinations.
Yeah, it was
Doc,
busy.
especially you. You put this thing together. But we had a nice little turnout. We started in Derby. I don't know if we want to do our picks. If we want to, we got to go with Josh first. We got Josh out there. He came through to finish off his shots, but this was at Senator Kane's event.
It's me politicking.
Yeah, we probably trying to get some money, Doc.
I'm out there politicking.
But no, that's the sisters. We was over on the east side. That's me with Nora, Miss Daisy. Some of Chester residents came out and got vaccinated.
Yeah, we were trying to hit up the Hispanic community, and so that was a really good event. And George managed to help us give away 40 book bags, right?
Yeah, well,
to the
50,
kids in that community.
I think it was 50. Somebody took like 10, but yeah. I think somebody had like 10 grandkids. I don't know.
Oh,
listen,
fine. Only thing that matters is the kids got the book bag. So they got into the hands where they needed to be. And that's all that matters to us. So thanks for your efforts and partnering with Reverend Dr. Ronald Williams to get us those book bags.
Chester Peace Initiative. Appreciate it.
Yep.
Yeah, it was a wonderful thing, Doc.
Yeah, we had a lot going on.
You did good, Doc. You showed up. You was engaged with the people. I learned a lot from you.
Oh, thank you. Thank you.
A particular parent that got one shot that she said she got sick from or whatever. She talked to me yesterday and said, we kind of worked on her a little bit to the point where she wants to get her second shot. Mm-hmm. So we're reaching these streets.
Listen, it's a 1-by-1 effort at this time. Mm-hmm. 1-by-1 effort. So, we're making a difference, and that's all that matters. And that makes me really, really, really happy and proud to work with you all on this stuff. So a bittersweet show. I think this is like episode 26. We've been doing this for about 6 months, and this is like our last official full COVID show. We've been doing this for 6 months. They can't say nobody told them. That's all I know. Right. They cannot say nobody told me this could save my life. This could keep me out of the hospital. They ain't gonna say that because we've been doing this for 6 months. We went from the Tuskegee experiment and how things have changed since then. We talked about how vaccines are maybe bought on a pharmacologist. Talk about how are the vaccines made? What is the clinical trial process? We talked about what is in the vaccines, what are the ingredients in these vaccines, and we talked about the history of vaccines over time and the impact that they've made. So we have like really covered this whole situation the best way that I could, so they can't say we ain't telling.
Right. That's true. I mean, it's so evident because, like you said, when we told everybody last week what the CDC, how they're moving forward,
Yeah,
how they feel like they told us enough, they've been helping us enough. Now we basically on our own. That doesn't mean we won't stop with the awareness. That
yeah,
just means we're just going to tackle some other issues regarding health,
yep.
regarding our people in the communities. But listen up. Like, we got the vaccinations, they still free right now.
They still free right now today.
Right.
That's about to come to an end. In fact, I know that the money that the government has put toward testing and vaccines and treatment and all that has like dried up. So in the next few months, this stuff is not going to be free anymore. It'll be billed to our insurance. So the people that's really going to be stuck is people that don't have insurance, and that is so unfortunate because we know that that's a disproportionate number of Black and brown people. And so take advantage of the free tests right now. I saw yesterday that COVID tests that the government shipped, they're going to suspend that on Friday. So that's the last day you can go to the post office website, put your information in, and get your free test from the government. Dr. Thomas, if you can put that website in the chat so people can use it in case they want to order a test. Friday, September 2nd is the last day, and that's going to get suspended. So this money is drying up. So y'all take advantage of the free stuff while you can.
Mm.
The other thing I wanted to mention is the COVID booster. So the FDA is going to be meeting about the new booster, the Omicron booster, I think toward the end of this week or maybe tomorrow and Friday. And so there's going to be a recommendation heading to the CDC about that, and the CDC will tell us what to do. So just be on the lookout to see when this Omicron booster is going to come out and who is eligible to get it and when they can get it. So we don't have any of these answers yet. We have to wait until the CDC puts out their guidance, but it should be coming within the next week or two. I kind of have mixed feelings about the Omicron booster. I mean, I just had COVID a few weeks ago. I'm pretty sure I had the Omicron variant, so I feel like I got some protection there. And so they don't really know how long that protection lasts, but I'm just like, do I need the booster when I already had the virus? And I don't know. George, what you think? Are you getting the booster?
Oh, here
I
you
know.
go.
Here I
You
go. I know.
always doing stuff. See,
I'm
we're gonna have to extend the show now. Listen, Doc. Oh my, what you
I
mean?
know.
You was the main one. I'm definitely getting it.
I know, but then I
I
be
mean, because you know
thinking.
what's scaring me though, Doc? Like, seriously, like a lot of people is getting COVID now. Like,
It's
so
true.
I
But it's
mean, a
the
lot
people
of
who
people,
didn't
people
get
that's
it.
been fully boosted, fully vaccinated,
That's true.
it's still getting through customs.
I
So
know.
it's time to re-up for the winter, Doc.
And we have to
Well,
think about our vulnerable people too.
that's
They're
true.
one of the local nursing homes I just found out is having a surge going through. So it's still going to be here, and we know that
That's true.
our older people are the ones that get the worst of it. So we just
Right.
had to keep that community kind of helping everyone in the community in the forefront when we make these decisions. So.
Right,
Well, thanks, Dr.
Thomas. Go
Thomas. I
again, Doc.
appreciate it.
Yeah. We get
All
ready
We
right.
to
do have the medications out now. So
right. I'm here
actually
to start giving
No,
her
I don't want the
pampers.
meds. I don't
No,
want no
I'm
new
saying for
medicine.
the vulnerable patients. Like I dispensed
Oh, I see
one
what
of the
you mean.
investigational ones to like a 90-something-year-old man.
Oh,
And I'm just thinking,
wow.
oh my
Wow.
goodness. Yeah.
I
So
take the vaccine over a new treatment any day. All right, I'm gonna get my Omicron booster. So, George, you getting it too?
I'm we can get it together.
All right,
Yes.
we can go get
We
it
can get it
together.
together, okay? I'm gonna
You
put
gonna
some
make sure
pampers in
I
your
get my.
mailbox tonight, okay? All right. I'm ready.
You gonna give me some information to read up on it.
Right, Doc, don't do that.
See, my problem is this is my problem. I start thinking, right?
Right.
Now, I know that because we are living through a disease period, trying to study it at the same time, and we don't have like all the information ahead of time. So what I want to know is what is the impact that specific booster is having on disease transmission, Is it reducing hospitalization rates? Is it reducing death rates even more? Because the original vaccine is still killing it. Like, it's still doing a good job keeping people out of the hospital, keeping people from like dying. So my point is, what difference is this new booster going to make? And we just aren't going to know until we have enough people boosted. And so I'm just like, well, let me see what it's going to do first. I'm not worried about it not being safe. I know it's safe. Like, I'm not worried about the safety. I just want to know what is the benefit I'm going to get from it. But like Dr. Thomas made a really good point, it's not always about me. And I had these conversations all weekend long with people. It's not even about you. So you talking about you don't want to do it because you're young and healthy. This is not about you. This is about us, everybody, and we got to get through this together. So let me give myself a pep talk, Kristen. Let me get your life together and stop. All right, let me get the Omicron booster. Thanks, Dr. Thomas. I forgot that it's not about me. It ain't about me. All right, so I want to remind y'all that if you do test positive for COVID, a lot of people didn't know this, and I was talking about this a lot all weekend. If you do test positive for COVID, the CDC is recommending that you stay home for 5 days. You isolate for 5 days, stay away from other people. If there are people that live in your house, put a mask on. If you have to be around other people, stay home for 5 days, and then for the next 5 days, if you leave your house, wear a mask. A lot of people are positive for COVID and they may not have symptoms, or you may be sick for a day or two. I think I was sick for like 2 or 3 days and I felt better. Just because I feel better does not mean I'm not contagious. I'm still contagious. So you have to wear that mask for those 5 additional days to keep everyone else from possibly getting sick. So again, this is not about you. It's not about me. It's about all of us. Please, as much as you can, stay home for 5 days, and then for the next 5 days, wear a mask when you're out and about. Wanted to remind people about that because a lot of people didn't realize that, especially when you start feeling better. Even though you feel better, you can still be contagious.
Right.
Ooh, child. All right. So last week we talked about the impact that the vaccines have made. We talked about the chickenpox virus. We haven't heard about chickenpox that much. You know, we all had chickenpox when we were younger. Our kids haven't had chickenpox. They got vaccinated. Like, it's not a thing like it used to be before. And then we also talked about the rotavirus vaccine and how the FDA snatched that right up off the market soon as they saw that it was causing those stomach problems in those children. So there are some things in place to make sure we stay safe, for sure. But today we're going to extend this conversation a little bit and bring COVID back into the mix again. This is our last show that's like completely dedicated to COVID, and kids are going back to school. So I wanted to do something for the parents to help them see and to help them make informed decisions about getting their kids vaccinated. So we're going to bring COVID back in and talk about some safety around the COVID vaccine. And so we have an amazing guest with us today, Dr. Karita Ambrose. She is a vaccinologist. Y'all hear that? She is a vaccinologist.
Okay.
She's worked in the industry for over 20 years. She got 2 decades behind her. She has her PhD. She's at the top of her field. She knows what she's doing. And she has launched several vaccines, including some that our children are currently getting. And hear all these ands. She is the senior director and serves as the head of U.S. medical affairs for a major pharmaceutical company. So we bringing in the top dogs today. If y'all don't believe nothing I say, if y'all don't believe nothing George said, if y'all don't believe Dr. Thomas, can y'all please believe Dr. Ambrose? She works in that. This is what she has done every day for 20 years. So she knows what she's talking about. Welcome to the show, Dr. Ambrose.
Hi, good afternoon, George. Good afternoon, Dr. Motley. Thank you so much for having me.
Yeah. I know I had contacted you earlier this summer, and it's just been a crazy summer. So I'm so glad we were able to bring you in before we close out this series. So thanks for being here. Thanks for being here.
And thank you for cycling back to me to get me in. I didn't realize when I was counting back how long it had been, and so thank you for not giving up on securing a time and date.
You was on my list. Don't worry, I was coming back.
Awesome.
So I just want to talk about the safety in vaccines for kids a little bit today. And so just kind of want to remind everybody that we've been giving vaccines to our kids for years. This is not like a new concept with COVID. In fact, I took my daughter to get her physical exam 2 weeks ago, and the doctor was like, she's due for 2 vaccines, which caught me off guard because I tried to be ready when I go in. And I was like, oh, what's she getting? So she ended up getting her 2 vaccines. I think we have a video of that.
Don't look. Deep breath.
She ended up getting her 2 vaccines. And I mean, this was about 10 minutes after I had to calm her down. I was like, Bria, if you don't sit here and get these little shots in your arm, you can see she got 2 shots in the same arm. And I know that, there are some questions about that. Is it too much to give? Too many? Can we get the flu shot and can we get the COVID shot together? And Dr. King was on a few weeks ago and he said the body can handle it. The body can handle as many vaccines as we need to give at the same time. It's not a problem. So just wanted to let y'all know and remind you to keep your kids updated on vaccines. Please, please, please. But Dr. Ambrose, how do we know that all these vaccines that we're giving our kids are safe?
So I think that's an excellent place to start. And in listening to some of the conversations that you guys have already had, I think it was really good points, to bring up, especially in talking about the history of vaccines. They've been around for more than 100 years, right? And we've seen some awesome results for vaccines and the impact that they've had. I have a slide that I show when I'm doing general presentations on the reduction in disease, and just, to name a few, Hib disease, that was a huge issue back in the 80s and 70s, and how that disease came down when the vaccine was introduced. You talk about chickenpox, and just that had such a huge health economic effect. Parents having to miss work and things like that. And once that vaccine was introduced, that went away. So it's very interesting to me that our kids have had this routine schedule of vaccines. But more questions came about, when COVID came along. And there are a few things, and I heard you mention the issue with RotaShield. And it's funny, I started working at the company that made that vaccine probably about 3 or 4 years after that happened. And to me, that's a clear example of how, if there's an issue with the vaccine, the steps that are taken to remove that vaccine to make sure that it's safe. There is a very low tolerance for vaccines, and there's a higher standard of safety, if you will, that's expected of vaccines, primarily because you give them to healthy individuals, healthy children, healthy adults. So they're not going to tolerate a vaccine that shows any type of issue that is not going to be perceived a benefit over the risk. And because of that, there are measures that have been put in place, both by the CDC, by the FDA, by Medicaid, to really look where you can report if there is an issue of vaccine. There are 3 very well-known ones where your healthcare provider can call in. That's the VAERS. Then there's the Vaccine Safety Data Link. Then there's a clinically immunization safety assessment. All of these systems monitor vaccine safety in general, particularly anytime a new vaccine is launched. And so by looking across those, you can actually look to see if there is a signal of some sort of a vaccine causing an issue. And there have been issues where vaccines have been stopped or have been halted till more information was obtained. Some there wasn't an issue, and so the vaccination with that particular vaccine was continued. But there have been others, like with the case of RotaShield, where they did stop and that vaccine was taken off the market. So there are measures that have been put in place for that, to observe that. And I think you just have to know how to read it, how to understand it. And just because someone reports, oh, my leg, my leg came off when I got vaccinated, there's a due diligence that is done by the medical community to see, okay, was that related to the vaccine or was there something else? And even times when you are reading in the prescribing information, what we call the PI, you might see the common side effects or what happens when you take this vaccine, and then you might see serious adverse events. Typically, when someone is in a study, anything that happens during that study period is reported and has to go in there. So even if someone was in a car accident, got hurt, that goes in that PI. Now, obviously, getting a vaccine didn't make that person get in an accident, but nonetheless, it does have to go in that prescribing information. So you just have to kind of understand what you're reading.
So it sounds like it's a lot of systems in place to make sure if anything comes up, it's caught.
That is correct.
Right.
Absolutely. Yep.
Did you have a question, George?
Yeah.
About that? Okay.
What about the same thing, or I can go into something else because I had another.
You can go something else. Go ahead.
Okay, Dr. Ambrose. Just a lot of people, they want to give like more time before vaccinating themselves in children against COVID. How long should they wait? I mean, it's been going on for a while. I mean, we had the vaccination out there, been circulating. We're already on booster number 3.
That is correct.
I mean, what you think, like the process is as far as the wait and how long, until they should be safe?
So my short answer is we know that the vaccines work and we know that they're safe. There's enough data out there that is convincing enough that shows the vaccine is safe and effective. When these trials were done, just to give a little bit more information on that, clinical studies are done. You have phase 1, phase 2, phase 3. They're looked at in animals, they're looked at, then they go into people. And so there are a number of things that are done to ensure the safety of the vaccines. For the COVID studies, because I think everything that was surrounding that, they had to go up on the enrollment of that vaccine. And so when you saw the 30,000 plus trial participants in trials, that is not necessarily the norm that is always done. And so that in itself was a huge feat, getting that number of individuals. There was also a big push to get a number of, there was a emphasis placed on minority recruitment, on people of color in those studies. And so you had a good wealth of safety information coming out of the trial itself, but it doesn't stop there. Once it's licensed, that monitoring continues on. And that's where we get what you call that real world data that's coming out. And so if you look, there have been 608 million doses of COVID vaccine given. That's through August 24th. They are safe. They are effective. Are there local and systemic reactogenicities that you get? Yes, there are. But in addition to the safety systems that I mentioned previously, the VSD, the VAERS, the CISA, there was one for the COVID vaccines. The monitoring of the safety of this particular vaccines was one of the most intensive safety monitoring systems put in place for any vaccine in the history of the U.S. I've been working in it for 20 years. I've never seen the measures that were put in place for the safety of a vaccine that was put in place for COVID. And that involved, and I don't know if a lot of people know this, but when you got your COVID vaccine, you should have gotten a sheet that had VSafe, where you could go in and sign up And so every day you could report how you were feeling. They looked at that information and they report out on that. There are publications on that. So any signal that might have been seen, you would have seen in that as well. So very intensive monitoring system putting up. There's no need to wait.
Okay.
That's really reassuring for me to hear that they like stepped it up in terms of the safety monitoring more than they've done for any other vaccine. So thanks for sharing that, because that means a lot.
Absolutely.
Even to me. And now I do have a question, just kind of going back to the safety and the effectiveness of the vaccine. So just really quick, this is for the audience. When we are looking at drugs or treatments or any type of intervention, we want to know two things. Is it safe and does it work? And so those are the two things. So when I say effectiveness, that's where I mean, does it work? So when we're looking at those for the COVID vaccines, I know that for the booster, a lot of talk have been going around about it was studied in mice. And I'm not sure how familiar you are with that process, but I know that Dr. Fauci said that that's what they do for the flu shot each year. So it's not studied in people before it's put out there. Are you familiar with that? And is it okay that it was just studied in mice and not studied in humans?
So I'm going to say, you mentioned earlier about the booster. Tune in, anyone that wants to see the results of the booster study. There is a meeting tomorrow on the advisory committee for immunization practices on the CDC. If you put in ACIP meetings, you can log in. Anybody can log into those meetings and they will be looking at that. So let me just address the mice, because I worked on this end in vaccine research. And so, yes, we do study if there's an animal model that we can look at for a vaccine or for a disease state. We do study it in animals first, and that will eventually go into man once we get enough animal data. That animal data has to look good to move to the next phase, which would be man. That's a serious thing, and the FDA is looking at all of that data before you can go into man. I do believe, and I have to, that the booster studies were not just done in mice; they were done in humans. And again, you can see that data. You can go to the FDA's website and look at those if they presented it there. But I know they will be presenting that data tomorrow on the CDC to that committee where we would get the recommendation from. You can't really compare COVID to flu, because we do flu vaccines every year and have been doing that for more than 50 years. So we know what those established protection levels look like in animals. So we don't put a flu vaccine in people every year, because we know what we're doing there, if that makes sense, right? We know what kind of responses we get and all of that for a flu vaccine. So it's kind of comparing apples and a whole nother, not even another fruit. Right. And comparing that with the history we have with a flu vaccine versus COVID vaccines.
I see. Okay, that makes a lot of sense. So y'all heard the doc. She said we know it's safe, so stop playing around. Go and get your vaccine.
Absolutely. And there's guidance around getting this vaccine. You know, we have COVID, but the other diseases are out there. We're approaching, fall and winter, where we tend to get other respiratory viruses coming into play, like RSV, influenza season. And so I do think it's important to stand up and continue to be vaccinated. And Dr. Motley, I heard you at the beginning when you said, how much additional protection is this going to provide with this booster? And we don't know, right? But wouldn't it be great if we have this new variant in there that we know is highly transmissible? Wouldn't it be great to start seeing an impact on that transmission? right? Because that's when we can really start to see disease rates go down. But as long as it's transmitting, and not to say stopping severe disease isn't great. That's exactly what we want. But we also, it'd be nice to see the transmission, slow down as well.
Yep, that's true. I'm gonna get my booster. Don't worry, Dr. Ambrose. I'm gonna get it.
You're gonna get it, Doc.
I just wanted to address that. I'm sorry.
Right. Let's give her some more stuff, Doc. She needs a little more info.
So pamphlets in my mailbox. Before we wrap up, I know that parents are really, that they have concerns about the side effects. So I just wanted to ask you, what are the most common side effects that are being seen in children that are getting vaccinated?
Sure. So if you, and everything I'm quoting and everything I'm sharing with you, you can get from the CDC's website. And if you really want to go back, you can get it from the studies themselves. So if you look at, because they were broken into different age groups, if you look at the younger kids from 6 months to 3 years of age, a lot of the common side effects there is just kind of both local, meaning where they gave me the shot was tender, sore. You might have some swelling, a lot of irritability or crying, loss of appetite, general just fatigue, just kind of sleepiness. You can get some fever there. And even with the older age group, if we look at the 4 to 17-year-olds, the same thing, pain and swelling where the shot was given, general tiredness, headache. You can have some chills and just some swollen lymph nodes. A lot of these are mild, they're temporary, and are very similar to what's experienced during the routine vaccinations. So those are going to be your common side effects for vaccines in the children.
Okay, that's good to know. So it's not really much different than what they would experience from any other vaccine that they would be getting anyway.
That is correct. That's right.
Okay, good. Now, what about serious side effects? So in healthcare, we talk about common side effects, what's common, what's mild, but what is serious? What do we need to look out for that is rare, but it could happen?
Right. Sure, absolutely. Now, what I haven't seen in the younger age group is where, but there are a few things that could happen that would be rare. You could have anaphylaxis, right? So you could have a type of allergic reaction after the vaccine. This is rare also, but it can also happen. We know that for instance, this isn't really even relevant for the children because the J&J vaccine is not licensed for kids. But we do know that there were about 4 cases out of 1 million doses administered where individuals did get the blood clots and had the issue there with the low platelets. So that's another very rare. The myocarditis and pericarditis. So this is inflammation of the heart muscle, which sounds really, really bad. But it's really where the heart muscle is just kind of becomes inflamed. This has been reported in male adolescents and young adults. The last statistics, so if I look at it and what has been reported through one of the VAERS systems, is between 12 to 15 years of ages, there were about 70 out of 1 million doses. And then 16 to 17, it was a little bit more, but then 18 to 24 was about in the low 50s out of 1 million doses administered. And so that they're still reviewing that. There's no, don't really understand why that is the case. The good thing is that all of these individuals that had that responded very well to medicine, rested, and felt better quickly. And so I think there's still a little bit more work to understand that. But there's not been any deaths or anything reported after that. So again, those are those systems that are in place that are working to do what they're supposed to do. Again, those are rare. The benefit of the vaccine still outweighs that risk. of some of those very rare issues that we have seen. The J&J is not an issue because that's not licensed for kids anyway.
Thank you for confirming and reassuring us that the vaccines are safe, and anything that is serious that could possibly happen is super rare. No children have died from having a vaccine, and children that have had the rare side effects recover pretty quickly. So
That's exactly
it's no
correct.
long-term problem to have to worry about. I know we have a question about can they get the flu shot and the booster together?
Yes, you can. There's been guidance around that. And so you can get your flu shot and your booster together. I will be getting my flu shot and booster together. I'm just waiting on the bivalent variant. So it'll be a whole family affair.
Thanks for letting us know. George, you want to close us out with one last question?
Let me see what I got. I mean, you gave some good stuff. Well, we already did the most serious. Okay, where can people find information about the safety of the COVID vaccine?
Yeah, so this is a good one, right? Because boy, I heard more. Facebook became the major, the doctor, and like, wow, when did Facebook become the medical institute of the U.S.? But I always tell people, the CDC website is very general. It puts it in lay terms. You can understand it. That is a good resource to go to. If you want something more global, the World Health Organization, WHO, that's a good site. And any institution that's credible, such as Johns Hopkins, they have a good COVID site, the Mayo Clinic, Yale, institutions like that. Blurbs on Facebook, my shoulder swole up when I got vaccinated. That probably did. That might happen because it says that. But, you have to consider the source of what you're reading. And that is something I always tell people. What is the source of what you're reading? And so I always stick to the CDC, WHO. Those are your good public health resources. And then look at your institutions that you're familiar with, that are credible, and that you can get some good information from. And your local health departments can give you good information or even direct you to sites that are good.
Wow.
Thank you. Thank you.
Great news.
Thank you. All kind of gems. We done all learned something today. So thank you so much, Dr. Ambrose.
Thank you.
Oh, George, what are we doing?
Thank you for doing this and all of your efforts. I enjoyed the first few minutes just kind of listening to what you guys have done. So I'm really glad I could be a part of that and just impart, some additional information around safety. So kudos to you guys for the impact this has had on the community and what you're doing.
Yeah.
Thank you. We just thank God for the opportunity. Thank you, Lord, for using us. Use me, Lord.
Yes, use us.
Hey, that's what you have to tell them to do. Just use me and direct me. And you can't go wrong there. So awesome job, guys.
Yep.
I appreciate it, Dr. Ambrose.
George, what are we doing next? Do we got anything coming up?
Oh, yeah, we're going to continue our vaccination tour. You can catch me in the dock at Labor 22, Local 413 on 291. That's on Labor Day, September 5th from 12 to 2. Shout out to those brothers. I think we did an event with them.
Yeah, with Mark Freeman and James Harper.
Yeah. So shout out to them. Just trying to get everybody on board and caught up while the shots and vaccinations are still free. So
while they still free, because this money is drying all the way up. So take advantage of it. That's a really good point. So just want to make sure, if you can't make it to that, if you want to go anywhere else to get vaccinated, you can go to vaccines.org to find out where else you can go to get the vaccine. I think we're done for today.
Yeah, thank you, Dr. Ambrose.
Thank you very much for having me. I appreciate the opportunity.
Thanks, Tyrone. Thanks, TJ, and everybody else that tuned in.
Thank everybody behind the scenes, sis, Les, Dr. Thomas, Dr. Mott. We out. We out.
See y'all. And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. you want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction, how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?